My name is Omid Kermani. I'm a practicing ophthalmologist in Cologne in Germany. Today I will be talking about immediate sequential bilateral cataract surgery, ISBCS, and we will have a look at the pros and cons of the concept. The prevalence of cataract not only in Germany will increase. In fact, this is a weighty argument when you consider that the number of cataract cases will almost double over the next 25 years, and not just in Germany. This development is due to the aging of societies in today's leading industrialized nations. The increasing number of papers published in recent years underlines the current high level of interest in the topic of ISBCS. The International Society for Bilateral Cataract Surgery, ISBCS, founded a few years ago, has published guidelines emphasizing that each eye surgery must be treated as a separate and individual procedure with separate sterilization cycles and routines and instrument trays, and lists a number of contraindications. It is estimated that around 30 to 70% of cases are suitable for ISBCS. Supporters of the ISBCS emphasized the convenience for patients and their relatives. On the other hand, it can be argued that the supposed advantages are also achieved by treatments on two consecutive days. The most important advantage, it is argued, is the time and cost savings. As a result, an increase in the number of cases of up to 20% can be achieved. However, it must also be emphasized that ISBCS currently entails considerable disadvantages in terms of remuneration in many countries. In Germany, remuneration for the second eye is reduced by 30% as part of the private patient's DRG and 75% reduction for public SHI patients. I've been working for statutory health insurers for over 30 years, and I can tell you that during this time there has only been one direction in terms of fees. The number of cases has risen, the fees have fallen. It doesn't take any prophetic ability to predict that we will trigger a hamster wheel effect with ISBCS. The more we operate, the less will come out of it. Only stress and problems will increase and the system threatens to fail. This is one of the arguments put forward by critics of the ISBCS. There are other arguments against the practice of ISBCS, particularly in connection with the development of refractive cataract surgery and the increasing number of advanced technology IOLs. Possible refractive surprises are listed as a counter-argument. Even more important is the argument that bilateral surgery also entails the risk of bilateral endophthalmitis. I would like to take a closer look at both. According to Jack Holliday, provided that the most modern diagnostic equipment and the best biometric formulas are used, we can now achieve an accuracy of over 98% in the refractive result. So why not bilaterally? Clinical practice for the average eye surgeon looks different in reality. According to David Cheng's research, we achieve a target refraction of plus minus 0.5 diopter in 80 to 90% of cases at best. One cannot simply dismiss the argument that in consecutive surgery, the refraction of the second eye is better adapted in the case of a refractive surprise of the first eye. The mere fact that there is now an acronym for bilateral endophthalmitis, BSPOE, makes you sit up and take notice. The most recent report of a whole series of cases dates back to 2023 and comes from Denmark. The risk of endophthalmitis in modern cataract surgery is very low, and it is estimated at 0.02 to 0.2%. According to the International Society of Bilateral Cataract Surgery, the risk of BSPOE is less than 1 in a million if the guidelines are strictly adhered to. Let's take a closer look at the 1 in a million figure. It's all relative. Most of you have already taken part in the lottery, I assume. In the German lottery, the chances of winning millions is much lower than 1 in a million. So how many million-dollar prizes do you estimate were paid out in Germany in 2023? 10? 15? 20? In fact, there were almost 180 lottery millionaires who hit the jackpot in 2023 in Germany. So what we learn is that the frequency of a rare conditional event scales with the frequency of the conditional circumstances. According to the experimental study of physicist Matthews, the manifestation of Murphy's law seems to be an inescapable feature of our universe. Who of us older people cannot confirm this from your own experience? I would like to tell you about an event that received a lot of public attention but was never published. In March 2000, there was a series of 7 cases of endophthalmitis out of 9 cases that were done that day at Dominikus Hospital in Düsseldorf. As fate would have it, a close relative of one of the victims of the complications was a newspaper reporter. In any case, the uproar in the media was immediately followed by investigations by the public prosecutor, private house searches, and the closure of the entire operating theater wing of the hospital. We must never lose sight of the fact that human error accounts for a significant proportion of preventable mishaps in healthcare. Even the most competent clinicians are not immune, not to mention the mishaps that can occur in a team, but for which we as surgeons have to take responsibility. Such a risk matrix as depicted is well known in many areas of engineering and critical industries. Where do we classify the ISBCS? Is the risk of BSP or E rather unimaginable, or is it just unlikely? Do we take an acceptable or an unacceptable risk? And what actually is the medical benefit of ISBCS? Weighing this up is the task not only of doctors but also of managers and investors. In summary, it can be said that ISBCS can contribute to an increase in productivity. Whether a positive economic result can be achieved remains questionable. Ultimately, however, we must ask ourselves whether we are taking a higher risk with ISBCS without any recognizable important medical benefit resulting from it. Thank you for your attention.